Did you know that many healthcare providers are losing millions of pesos in claims due to poor documentation? Yes, you heard it right. Millions of pesos. Doctors and hospitals go about it the wrong way. In my almost 2 decades in claims processing, I can confidently say that documentation is one of the major reasons why hospitals are losing millions in Philhealth claims. Now, some of you will react and say, "What?" Now, give me a few minutes on this. So, what is documentation? Now, documentation in claims processing is the process of providing proof or providing record that will support the services given to a Philhealth patient. So, common sense will tell us that documentation will lead to a document. Now, this can be a soft copy or a hard copy document. Now, I have said this a million times in many of our webinars and trainings. Philhealth is not about money. Philhealth is all about information. Give Philhealth the right information and money will follow. Now, to understand the concept, I have a guide for you. So, Philhealth will only pay hospital claims reimbursement if the hospital can provide proof that quality services were given to the patient. Now, so how does this work? Philhealth, will not join you in your daily rounds or surgery. They will not be in the accounting office nor in the medical records. Philhealth will require hospitals to submit documents electronically. So these are Philhealth claims form 1, 2, 3, and claim form 4. And you have the statement of account, you also have the lab results, and even clinical charts. So what is the logic behind this? So earlier we said that Philhealth payment will happen if the hospital can provide proof of quality services. So documents that you will submit is the proof of quality service. If your hospital cannot submit the documents, then there is no proof of services. If your hospital will submit incomplete documents, there is no proof. If your hospital will submit documents that are unreadable by the system, there is no proof. If you submit documents beyond the prescribed time, there is also no proof. If you submit documents with errors in spelling, dates, signatures, or inconsistencies, there is no proof. Thus, there will be no payment. It is very simple. How come we are not paid? Yes, it is very, very simple. So for several years to a decade, the problem is the ability to write the details of the services that were done. Most of the time, the documentation done results in incorrect information, incomplete information, and inconsistent information. Now, the issue is poor documentation. Many hospitals take this for granted. So, can you show us examples? These are the common top RTH or denied claims. Now, many are repeatedly done for a decade. Example, you have denied due to non-compliance to the standard of care. This means that the CF4 is not properly done. The clinical information needed in the CF4 is incomplete. Denied, filed beyond 60 days or 120 days. The documents were sent beyond the required period. Denied, case not compensable. The diagnosis in the document did not match in the all case rate list. You have denied due to non-compliance. This is when Philhealth is asking for a document for correction of error, and then the hospital transmitted the wrong document. You also have RTH, document is unavailable, unreadable, or XML error. Philhealth cannot view the soft copy document that was sent. So, for them, there is no document, but the XML format for the document is actually the real problem. You have RTH, the CF2 or probably the CSF, okay, is not properly accomplished. The document sent, okay, had incomplete information. It's as simple as that. So the next question, how do we solve this problem? This can be solved if you train your non-clinical staff on proper documentation. Okay? They need to know what to encode and what not to encode. You need to train your doctors on how to make a good CF4. Now, there is a proper way of doing this. Tell your doctors that the shortcut method will not work. You need to train your doctors on how to document complete clinical information. Now, both the non-clinical and the clinical staff must be trained. If you do not have this training, okay, your claims will end up as RTH, denied, or goes to legal. My friends, email us if your team, your doctors, or maybe your hospital needs assistance. We have trained so many hospitals and we have trained so many doctors. This is Coach Doc Ben. See you in the next session.